Dr. Hani, thank you. That was an amazing talk. And to see what Saudi has done in such a short time with technology is really remarkable. So we have a few questions, and I'm going to send two through to you. So the first question is from South Korea, which you referenced in your talk. And they pointed out the remarkable success they've had in control. And one of the features of the technology that they used was akin to geofencing, but somewhat different, where they SMS messages were sent to anyone who was going near an area where a case had occurred. And for people in an area where a case was reported, they received a text message. Does your system have that functionality?
I'm not hearing you, but do you mean that like Taba'ud, the one we have where if I share my data so people can see, is that what you were highlighting for?
No, the system in South Korea is a little bit different, so that if you are going to the market and somebody there, there's been cases reported there, you get a message saying you should be aware not to go to the market, because there's cases of COVID. So do you notify people where there are hotspots?
The hotspot function is a little bit we thought of it, but some challenges came in around. The business owners were a little bit uncomfortable. They said we will do our all of our exercise or homework to clean the place, make sure that all employees exposed and positive are removed from the service, but not to stop the service in the place. So we left it proactively for them. However, people who were entering, if they have a red light in their Tawakkalna, the app, they will not be allowed inside there. Even employees. If I'm an employee in a supermarket and I'm showing my Tawakkalna app a red color, then I will not be allowed to go into my job. If I'm tested positive, I can't go to my work.
Right.
So we used it on the other way around, similar to South Korea, but on the other way around.
Right. Yeah. Thank you. Another question asks for your opinion in contrasting what's happened in Egypt versus Saudi Arabia. And according to the questioner, the curve in there's still COVID-19 in Saudi Arabia, but Egypt is on the down slope. What accounts for the differences between the two countries? And he or she especially points out that Egypt had a partial lockdown where Saudi Arabia had a complete lockdown. Why do you think the pandemic curves look different between Egypt and Saudi Arabia?
I don't know what was happening in Egypt exactly, but I can tell you what was happening in Saudi Arabia. We in Saudi Arabia, from the beginning, decided that we need to test everybody with symptom and every contact. So we worked night and day to provide extremely easy access to testing. We have 100,000 testing capacity every day. Because it is very easy, we never hit that number. Our numbers is around on the average of 60 to 70,000 per day, but we have a capacity of 100,000. So we have an excellent space for testing people and access to care. That will automatically reflect on the number of cases countries reporting. The second element is the ICU capacity and ICU utilization. We have dedicated intensive care beds in every hospital. It's a long story, I don't want to start with it, but we started with 25 hospitals, then we grew up in the number of hospitals, then we said that every single hospital in the country should have a certain number of hospitals dedicated for COVID. So, and we never reach the upper limit in these hospitals. So it means that we provide easy care, easy access, and quality of care that make us look that we have a good, high number of cases, but on the other hand, we have an excellent outcome. Mortality rate in Saudi Arabia, just 3,300 something, and I think we look good in terms of mortality and ICU occupancy rate. So the number of cases is because of the easy access to testing. Anybody can go test anytime and anywhere in the country.
Right. Okay. So one last question. Saudi Arabia went through MERS, which was a terrible experience. How much do you think that experience with MERS and being through that epidemic has prepared you for the response to this pandemic?
Actually, MERS was, when we look at it as a disease, we feel we have a better taste. But on the other hand, actually, we learned a lot from MERS. We created our command and control center because of MERS. We created our EOC because of MERS. We created our, there is a certain supply in public health. I don't think many countries have it. A certain strategy for public health supply chain. That's why we have never had an issue with the supplies of PPEs, because we were well prepared. We have a roadmap, so we were able to build up our scalability requirement for PPEs, and we brought and we encouraged local manufacturing. We pushed out our bar way before we get hit by cases, and all of that was learning from MERS, actually, as a matter of fact.
Great. Well, thank you for an incredibly interesting presentation, and I wish you the very best in your work ahead. The challenge is not yet over, but hearing the preparation and the facilities that you have is really encouraging. So I ask everyone to please join me in thanking Dr. Hani, and thank you for listening to this session.
Thank you very much. Thanks a lot.